Hi, my name is Cindy Farr, and I'm the Incident Commander with the Missoula City County Health Department's COVID-19 response. Today is Friday, August 20th, 2021, and this is our COVID briefing. Currently in Missoula County, we're reporting 59 new cases of COVID-19 since yesterday, with 362 active cases. We have 11 Missoula County residents hospitalized for COVID-19 and 13 non-Missoula residents, and we've had 103 deaths from COVID-19 to date. Just a point of clarification, when we report hospitalizations, we're only reporting people who are actually hospitalized to treat their COVID symptoms and not those who happen to test positive if they're in the hospital for something else. So I just wanted to clarify that. Our 7-day average incidence of new cases in Missoula County is now up to 34 cases per 100,000 people, compared to 6 cases per 100,000 people just 1 month ago. We're now considered by the CDC to be in a county in the red zone with high transmission of the virus. Across the state and nation, we're seeing increased transmission, hospitalizations, and death from COVID-19. Our hospitals are feeling the burden here in Missoula County as well. The significant rise in cases here and nationwide is largely due to the spread of the Delta variant. So let's talk a little bit more about the Delta variant. According to the CDC, the Delta variant is about as transmissible as chickenpox, with each infected person infecting as many as 8 or 9 others on average. With the original strain of COVID, the CDC indicated that it was about as contagious as a common cold, with each infected person only infecting about 2 other people. According to the CDC, more emergency departments nationwide are filling up with people who have tested positive with COVID-19, but around 90% are unvaccinated, and that seems to be the number one parameter to hospitalizations with COVID-19 or the Delta variant. In Missoula County, both of our major hospitals are short-staffed, and they're seeing a large increase in COVID-19 hospitalizations. Both Providence St. Patrick Hospital and Community Medical Center told the mayor this week that they're concerned about staffing, bed capacity, and the surge in COVID-19 cases. The Delta variant appears to be making younger individuals sicker also, so it's critical to get even healthy young kids aged 12 and older vaccinated because of this. Pediatric ICU beds in many of the southern states are full right now due to the Delta variant spreading. So let's talk about what we can each do as individuals to reduce the risk of transmission of the Delta variant and reduce the strain on our hospitals and clinics here in Missoula County. I know I sound like a broken record, but the same precautions that we've used throughout the pandemic will also help protect you from the Delta variant. Get vaccinated. The vaccine will help keep you from getting COVID, and if you do have a breakthrough case of COVID after vaccination, you will be less likely to develop severe disease or to die from the virus. Wear a mask when you're in public spaces, especially if it's difficult to maintain 6 feet of social distancing. Keep your social circles small. Last year at the same time, we were seeing an average of 5 to 6 close contacts to each case. Right now, we're seeing anywhere from 10 to 25 close contacts per case. This creates a huge burden for our contact tracers to keep up with, and it's causing a delay in our contact tracing efforts. Lastly, stay home from work or school if you develop any symptoms consistent with COVID-19 and get tested. We're still testing at our site out at Flynn Lane, and you can call 258-INFO to schedule a test. So next, let's talk about the new guidance released this week regarding third doses of COVID vaccine. This week, the CDC put out new recommendations that people who are moderately to severely immune compromised should receive a third dose of an mRNA vaccine. So that would be the Moderna or the Pfizer vaccine. That third dose should be given at least 28 days after your last dose of COVID vaccine. This recommendation is for people who have been receiving active cancer treatment, receiving an organ transplant, and are taking medication to suppress the immune system, received a stem cell transplant within the last 2 years, or are taking medication to suppress the immune system, those with moderate or severe primary immune deficiency, advanced or untreated HIV infection, and those undergoing active treatment with high-dose corticosteroids or other drugs that may suppress your immune response. If you're unsure if you fit into the immune suppressed category, you should talk to your healthcare provider about your medical condition and whether or not you should receive an additional dose of that COVID vaccine. If you do have a qualifying condition and would like to receive a third dose of vaccine, you can make an appointment at our Southgate Mall Vaccination Clinic by going to missoulainfo.com, or you can call 258-INFO and they'll help you get scheduled for that appointment. Our mall clinic also takes walk-ups 7 days a week, so you can just go in whenever it's the most convenient for you. So next, let's talk about booster shots for the general public who are not immune compromised. Earlier this week, the U.S. Department of Health and Human Services announced that they expect a recommendation to come forward for the general public to receive a booster dose of the vaccine. Once booster shots are officially authorized by the FDA, they're estimated to be administered as early as September. Nursing home residents and frontline healthcare workers will be the first eligible for the booster dose because they were some of the first people who were originally vaccinated. According to the CDC, 8 months after your second shot for fully vaccinated people, you would be eligible and recommended to go and get your booster shot. Right now, the FDA is only considering authorization for Moderna and Pfizer boosters, and more studies must be conducted in the Johnson & Johnson shots to see if the boosters will be necessary. The third dose recommendation for immune compromised people are not considered to be their 8-month booster shots. That group will likely need another booster shot down the line. The reason that immune compromised people are getting third doses is due to the fact that data is showing that they likely did not receive full protection from their first 2 shots due to their immune issues. Needing booster shots doesn't mean that vaccines don't work. This is a common misconception that's spreading online right now. Several vaccines need booster shots, such as tetanus. Also, several vaccines need multiple doses to be completed, such as polio, hepatitis B, and many others. Needing multiple shots or boosters is not indicative that a vaccine doesn't work. The COVID-19 vaccines are also not 100% effective, but that doesn't mean that they don't work at all. That's another misconception that is out there right now. The mRNA COVID-19 vaccines are among the most effective vaccines ever produced, and they prevent severe illness and hospitalization at very high rates. So last, I want to talk about COVID prevention in K through 12 schools. According to the CDC, vaccination is the leading public health prevention strategy to end the COVID-19 pandemic. Promoting vaccination among those who are eligible to receive the vaccine can help schools safely return to in-person learning, as well as extracurricular activities and sports. Due to the circulating and highly contagious Delta variant, the CDC recommends universal indoor masking in schools by all students, staff, teachers, and visitors to K through 12 schools, regardless of vaccination status. Guidance from the CDC on contact tracing in schools has also changed, and they're now recommending that if a school has a universal masking mandate, then students who are exposed to a positive case of COVID are in that 3 to 6 foot exposure range, those students would not be considered close contacts, and therefore they would not need to quarantine. Students and teachers and staff should stay home when they have signs of infectious illness and are close contacts to anyone who tested positive for COVID-19, and they should be referred to their healthcare provider or come into our Flynn Lane facility for testing and for care, regardless of your vaccination status. Just a reminder that all mask mandates in schools are determined by each school district's school board and not by the health department. We simply give them the data and the CDC recommendations so that they can make informed decisions. Okay, that was a lot of information for today. I do plan to get these updates out to you at least once a week and more often when time permits. As always, you can subscribe to my YouTube channel under my name, Cindy Farr, CINDYFARR. Hit that subscribe button so that you get notified when additional videos are uploaded. You can check out our Facebook page at Missoula City County Health Department. You can call 258-INFO if you would like to schedule a test for COVID-19 or if you have questions about COVID. And you can check out our website at missoulainfo.com for the most up-to-date information and the most up-to-date data. So until next week, everybody, stay healthy.